Hey guys, let's see today viral news.
For over 75 years, the NHS has been the backbone of British society, founded on the belief that healthcare should be free for all. It's more than hospitals and clinics. It's a symbol of national pride, touching every family at life's most critical moments. But today, this cherished institution is under unprecedented strain. Years of rising demand, underfunding, and the impact of COVID-19 have pushed the NHS to a breaking point. Stories of long waits, overwhelmed emergency departments, and exhausted staff are now everyday realities. The core promise of timely, effective care is being tested like never before. The system faces a perfect storm: an aging population, outdated equipment, and a severe staff shortage. The question now, can this vital public service be saved? The NHS crisis is most visible in the numbers, where over 7 million people in England are waiting for treatment. The target for starting treatment within 18 weeks hasn't been met since 2016. In A&E, nearly 4 in 10 patients wait more than 4 hours, far from the 5% target. Corridor care, where patients wait on trolleys in hallways, is now common. Ambulance response times for emergencies like heart attacks have soared, sometimes taking nearly an hour. Delays in cancer care are especially alarming, with thousands waiting beyond the crucial 2-month window for treatment. These aren't just statistics, they're life or death moments for real people. The NHS is struggling to deliver on its most critical promises. At the heart of the crisis is a workforce emergency. Over 100,000 NHS posts are unfilled. Staff shortages mean existing workers face relentless pressure, leading to burnout and high turnover. Nearly half of NHS staff report work-related stress, and many are leaving for better work-life balance. Recruitment is faltering, with nursing applications down 35% since 2021, and the NHS increasingly reliant on overseas staff. More than 1 in 5 NHS workers were trained abroad, raising questions about sustainability. Frustration over pay and conditions has led to historic strikes by doctors, nurses, and paramedics. These strikes highlight deep-rooted problems: years of pay cuts and impossible workloads. The workforce crisis threatens the very foundation of the NHS. Behind the statistics are real people, patients left waiting in pain, families facing uncertainty, and staff stretched to their limits. The winter of 2024-25 saw hospitals overwhelmed by a surge of flu, COVID, and norovirus, pushing the system to its limits. Operations were cancelled and patients waited days on trolleys for a bed. Cancer patients face agonizing delays, impacting both survival and mental health. Even getting a GP appointment has become a daily struggle, leading to worsening health and more pressure on hospitals. Delays in care and chronic conditions create a vicious cycle of declining health and increased demand. The patient experience is now one of frustration, anxiety, and eroding trust. The NHS's promise to be there in times of need is being broken for too many. The NHS crisis is deepening health inequalities across the UK. Where you live and your income now play a bigger role in your health and access to care. People in deprived areas get sick younger, have more chronic illnesses, and die earlier than those in wealthier areas. Cancer death rates are 60% higher in the poorest communities, with thousands of avoidable deaths each year. Fewer GPs in deprived areas mean longer waits and sicker patients arriving at A&E. As the NHS struggles, more people are turning to private healthcare, creating a 2-tier system. This undermines the founding principle that care should be based on need, not ability to pay. The risk of crumbling public service for those who need it most. The government faces immense pressure to fix the NHS, but its approach is cautious. Plans focus on reform and efficiency, with greater use of the private sector to clear backlogs. Critics warn this could undermine NHS values and deepen inequalities. Fixing the workforce crisis is the biggest challenge. Training more staff will take years, but Pay and conditions need urgent attention. The future of the NHS depends on retaining and supporting its people. As of early 2026, the service faces record waiting lists, exhausted staff and crumbling infrastructure. Restoring the NHS will require investment, political will and a renewed national commitment.
Thank you for
The
watching,
question
guys.
remains,
Subscribe
can
for
our
more.
NHS be